So PCOS is polycystic ovarian syndrome, kind of a bad name, kind of a misnomer if you ask me, because it's essentially it's implying that everyone who has this syndrome has multiple cysts on their ovaries, which is actually not true. Not everyone has cysts on their ovaries, but really what it is it's an endocrine disease that is usually you have a insulin resistance, so you're kind of trending towards diabetes, and you often also have a high androgens, so high levels of testosterone or other androgens like precursors to that, like DHEA. So it's those two things. It's the high insulin and high androgens that are the trouble causers, and then you got to get a whole bunch of other things that may happen. You may have irregular cycles, you may not. You may have infertility, you may not. You may have ovarian cysts, you may not. So it's a lot of like vague things. And unfortunately, there's no single one test that we can do that says you have this versus you don't. It's kind of like a compilation of symptoms and tests that come
Mm.
together. But unfortunately, it's about 10 to 15% of women who are cycling have PCOS.
Yeah.
And 75% of them, I think, ish, are undiagnosed.
Right. So a lot of women have PCOS and just don't know it. And that's what's going
Very
on.
common. Yes.
How do you identify it when you are meeting with a patient? And then I want to try and get into like what are some of the things that women can do?
So, I mean, some of the symptoms that may go along with it, irregular cycles, like I said,
Mhm.
that's one you should always have a workup for that.
Mhm.
If something like high androgen symptoms, like if you're having extra hair growth on your face or you're
Mhm.
losing hair on your scalp, or things like that are can sometimes be seen with PCOS,
Mhm.
not always. But if you're having those kinds of symptoms, infertility, you've been trying to have pregnancy, or you're having early loss of pregnancy, like in first trimester, is
Mhm.
often seen with PCOS as well. But some women don't have a lot of symptoms. The testing usually will start out with just simple blood tests. We'll do blood tests, then look at your some hormone levels. You look at your testosterone, your DHEA, your DHT. These are all androgens.
Yeah.
Also look at your insulin and your blood sugar and see
Mhm.
if you have evidence of insulin resistance, which is oftentimes seen with that. You can also look at your AMH, which is another blood test that
Mhm.
looks at your essentially how your brain is speaking to your ovaries.
Right.
And so there's some tests like that, FSH, LH, some blood tests that we can look at. And then you can also kind of go further. You can do like an ultrasound of the liver. Oftentimes these
Mhm.
women will have a fatty liver on their
Mhm.
ultrasound without even knowing that they had that. So you kind of put all those pieces together and then can usually get a diagnosis.
So there's an overlap between PCOS and diabetes, correct?
Yes.
And
Yeah.
so is it possible that a woman's going into her doctor with all these symptoms and they're being mistreated, right? For something like diabetes where they might have PCOS or vice versa. I mean, how do you see that those two things correlate?
Yeah, I mean, a lot of PCOS, a lot of women will have some insulin resistance, meaning they either have prediabetes, some will have diabetes.
Mm.
There is quite a bit of overlap. The treatment for the insulin resistance piece is it's going to be helpful whether they're kind of just purely pre-diabetic or they also have PCOS. So, like, oftentimes it's certainly lifestyle, certainly working on
Mhm.
low glycemic foods and getting enough protein and exercise and stress management, all the things we talked about. But then also will oftentimes add a medication or supplements like berberine or dihydroberberine can be great for this,
Mhm.
or like the GLP-1 medications like Ozempic, Wegovy. Those are actually great for PCOS, or some other drugs called the SGLT2. So there's some drug categories that can be helpful whether you have
Yeah.
PCOS or just insulin resistance, but always the foundational stuff with lifestyle and maybe some supplements too.
So when you're seeing someone, either if they've got PCOS, they're younger, or they're going through hormone replacement therapy, hormone optimization therapy for menopause, perimenopause, are you also addressing lifestyle? And what are some of the things that are, again, kind of the foundational non-negotiables with lifestyle, just particularly focusing on women's hormone health?
For women, especially as we get older, the resistance training, weight training becomes even more important. Like, starting at like 30, 35, I really want you to be focusing on muscle building and bone health, because by 35 your bones are as strong as they're going to be, and it just gets worse. So you really want that peak to be high. So lots of jumping exercises, sprinting, high intensity kind of interval stuff that like gives your bones impact is important. Weight training is important. Then everything else, the sleep, the diet, all of those things continue to be important no matter what age you are.
Thankfully, I do think that's a good trend that's happening with women right now is not necessarily competing in bodybuilding, but it's really focused on just like great muscle building. And I think that's kind of a more and more I'm seeing, at least for my peer group, 30s, I'm starting to see more and more women get into that, which I'm like, that's awesome.
You need to be doing weight training at least 3 days a week, and it should be like heavy weights. Like it's not like
Yeah.
these little baby barbells, and you're
Yeah.
you're you're doing like Jane Fonda
Yeah.
exercises. This should be like this. You're grunting and you're sweating and you don't look pretty. Like
Yeah.
that's the kind of weight training you want to be doing.